Hi everyone, my name is Justin Hansen, and I will be presenting on excoriation disorder, also known as skin picking disorder. The Diagnostic and Statistical Manual of Mental Disorders, also known as the DSM-5, places this particular disorder under the categorization of obsessive-compulsive and other related disorders. The diagnostic code for this disorder is 698.4, parentheses L98.1, and all of the relevant information pertaining to this specific disorder can be found on page 254 of the DSM-5. Diagnostic criteria. In order to be diagnosed for excoriation disorder, one must meet the following diagnostic criteria. Criterion A, which is recurrent skin picking of one's own skin, which results in the formation of skin lesions, especially in areas of the body such as one's arms, hands, and face. Criterion B, which is repeated attempts to decrease the frequency of skin picking or attempts to stop altogether, with little to no success. Criterion C, which is the skin picking causes clinically significant distress or impairment in one's social, occupational, or other important aspects of daily life. Criterion D, which states that the skin picking is not associated with the physiological effects of a substance or another medical condition. And lastly, criterion E, which states that the skin picking is not better explained by symptoms of another mental disorder, such as delusions seen in symptoms of psychotic disorder, attempting to improve a defect as seen in symptoms of body dysmorphic disorder, stereotypies seen in symptoms of stereotypic movement disorder, or intentional harm to oneself as a result of non-suicidal self-injury. Course and prevalence. The development of excoriation disorder most commonly takes place in adolescence, around the time a person experiences puberty, and may coincide with the presence of skin conditions such as acne. According to the American Academy of Dermatology Association 2023, acne is one of the most prevalent conditions, with it affecting 50 million Americans annually and 85% of people worldwide between the ages of 12 and 24. All of these factors play a role in the development of disorders such as excoriation disorder, where people may take desperate measures to remove blemishes and imperfections as quickly as possible without keeping in mind the long-term damages and scarring they may accumulate by doing so. The skin picking episodes are typically chronic, but may also come and go for extended periods of time. In terms of the general population, according to the DSM-5, it is estimated that excoriation disorder affects 1.4% of adults, and out of all the people diagnosed with the disorder, about 75% of them are female. Prognosis. The prognosis for excoriation disorder is that people with a prior diagnosis of obsessive-compulsive disorder have a higher probability of developing excoriation disorder than the rest of the general population. Direct family members living with someone diagnosed with excoriation disorder also have a higher probability of developing excoriation disorder than the rest of the general population. Cultural considerations. Some cultural considerations to take into account when dealing with this disorder may be the heightened emphasis on body image in today's society. Social media and other media outlets are flooded with images of unrealistic body standards in the forms of models with clear skin and seemingly no imperfections, and people seem to idolize and crave to look exactly like some of these people. And while this may serve as a source of inspiration to change one's unhealthy lifestyle habits, the reality of the matter is that some of these physiques and clear skin all take immense amounts of work, time, dedication, and money to achieve that the average working person with various daily responsibilities simply does not have. On top of this, social media serves as an outlet for bullying and other hateful speech, specifically dealing with fat shaming and other body image hate. Many social media platforms also provide tools for touching up and distorting one's image through the use of filters and Photoshop in order to cover up things people consider to be imperfections and flaws, whether it be weight or blemishes. These tools can be a gateway for practices such as catfishing, where someone's online image and persona is not true to their true actual appearance. Relevant literature on etiology of disorder. According to an article by Healthline 2017 and the National Health Service of the United Kingdom 2021, the main causes for excoriation disorder include episodes of boredom, anxiety, depression, shame, and/or stress, family history of excoriation disorder, the presence of acne, wounds, and/or skin conditions that provoke itching or the removal of blemishes and imperfections. Assessment of excoriation disorder. According to the National Board for Certified Counselors, 2016, 3 skin picking scales utilized by Cuthin and others, 2001, can be utilized in the assessment of excoriation disorder. One of the scales, the skin picking scale, or SPS for short, utilizes a client's skin picking self-reports to cover facets such as the frequency of picking urges, time spent skin picking, and level of distress these picking habits bring, just to name a few. Each question is answered on a scale from 0, meaning none, to 4, meaning extreme. Another scale is the Skin Picking Impact Scale, or SPIS for short, which also uses self-reports that measures the effect skin picking has on a person's self-image and social relationships. The scaling system applies to 10 questions and is rated on a 0 to 5 point scale, with 0 meaning none and 5 meaning severe. The last scale is the Skin Picking Impact Scale shorter version, or the SPIS-S for short. This self-report questionnaire only has 4 questions and covers the same aspects the previous scale does, as well as utilizes the same 0 to 5 grading scale. Differential diagnoses for excoriation disorder. So potential differential diagnoses associated with excoriation disorder would be psychotic disorder, which involves the initiation of skin picking practices as a response to a delusion or hallucination, and is therefore disregarded as a potential diagnosis since it is not associated with obsessive compulsive behaviors. Stereotypic movement disorder involves skin picking as a result of repetitive self-injury and has an onset in the early developmental period of a person's life, and is therefore disregarded because it involves self-injury, which is excluded from excoriation disorder's diagnostic criteria. Treatments for excoriation disorder. According to Cleveland Clinic 2022, some of the medication options for excoriation disorder include antidepressants, most commonly selective serotonin reuptake inhibitors, also known as SSRIs, and nutraceuticals, which are nutrition-related products that provide supplementation of the amino acid needed to help reduce the urge to pick. Some therapy options include cognitive behavioral therapy, also known as CBT, habit reversal therapy, and group therapy or peer support. And then lastly, we have an example of a case study for excoriation disorder. So Jessica is a 23-year-old and is a foreign exchange student from Spain who is completing her bachelor's degree in biology in Los Angeles. Her friends from school report that she has been seen with an increased number of skin lesions and scarring on her arms and face than they've ever seen on her before. In the past, she has been observed studying in the college library, picking at one area of her face for about 15 minutes straight until she began bleeding and wiped herself with a tissue. There has been a 3-month period of time during her second semester where lesions and scarring on her face and arms appeared to be lighter and less visible, but that towards finals week, she came onto campus with her face and arms visibly red and irritated from obsessive scratching and picking the night prior. As of this past week, her friends report that she has appeared very reserved and self-conscious of her appearance. She ranted to her friends about how she has tried multiple cover-up foundation products to try and cover up her lesions and scars, but that she thinks they are too red and irritated to be completely invisible with the use of the products. So from this case study, Jessica was assessed by a psychologist, and she met all the diagnostic criteria for excoriation disorder in that she has a formation of skin lesions from picking, she has attempted to stop picking for a period of time, her social and emotional state has changed negatively because of picking, and the skin picking is not associated with substance abuse or other conditions. She would not meet the criteria for a differential diagnosis of psychotic disorder because her skin picking is a result of stress and anxiety from her academic work and anxiousness while preparing for upcoming exams and not hallucinations or delusions. She would also not meet the criteria for stereotypic movement disorder because the skin picking is not a result of self-injury or had an onset of symptoms in her early prepubescent developmental stage of life. And these are all the references. Thank you.